In this lecture, we will be discussing the treatment of the chronic hepatitis B. Acute hepatitis B is treated in the same fashion as that of hepatitis A. But before we really proceed towards the treatment of the chronic hepatitis B, I want to give you some core concepts regarding the chronic hepatitis B infection. What happens whenever body is infected with hepatitis B virus? Soon after the infection, hepatitis B virus attacks the hepatocyte. So body launches the immune response against that hepatitis B virus in order to eliminate it from the body. If that virus is eliminated from the body within the duration of 6 months, then we usually call that the patient has not gone into the chronicity. If it takes more than 6 months or years, or even if fails to eliminate it, then we call it the chronic hepatitis B infection. Now, chronic hepatitis B infection has been divided into four phases. That is the immune tolerance phase, immune clearance phase, immune control phase, and the reactivation phase. When a baby gets infection from the mother via the vertical transmission, he or she usually goes into the immune tolerance phase, because liver is still immature to launch immune response by increasing the amount of its enzymes against that virus. So usually the virus goes on multiplying in that phase, but patient does not require treatment in this stage because still the patient is asymptomatic. So immune tolerance phase, immune is just tolerating the virus. There is active replication of virus within the hepatocyte cell, but still the enzymes, liver enzymes are normal. In the immune clearance phase, now immune is trying to clear that virus. Usually the immune tolerance phase proceeds to the immune clearance phase. In the immune clearance phase, immune system is now trying to eliminate that virus from the body by launching immune response against that by increasing the amount of enzymes. So this stage requires the treatment. The destiny of this immune clearance stage or the phase is either the antibody is formed against the hepatitis B E antigen or not. If the antibody is formed, then patient really go into the carrier state. That is the immune control phase. And this immune control phase even does not require treatment. But it is just like that of the atom bomb. It may burst any time. So it may be reactivated. The virus, depending on the body health and the environmental factors, it may be activated, it may be reactivated, and may go into the reactivation phase. Now this reactivation phase again requires treatment. So among the four phases of chronic hepatitis B infection, immune clearance and reactivation, these both stages require treatment, while immune tolerance and the immune control, they just require monitoring. So we know that ultimate end stage of almost all chronic hepatic pathologies is the cirrhosis. So before treating the patient who is going to be treated, you must see whether the patient has developed cirrhosis or not. Oh yes, if the patient has developed cirrhosis, then see whether it is composited or decomposited. To what you call the decomposited cirrhosis? If the patient has developed jaundice, if the patient has developed varicose bleed, if the patient has developed hepatorenal syndrome, if the patient has developed hepatic encephalopathy, if the patient has developed hepatopulmonary syndrome, if the patient has developed spontaneous bacterial peritonitis. If all these patients have failed, then we usually call it the decomposited cirrhosis. If not, then we call it the composited cirrhosis. Now, treating the decomposited cirrhosis, first of all, keep this thing in your mind that there is no need of doing the viral load, because already patient has gone into the decomposition. The main aim of treating this decomposited cirrhosis is to prevent the patient from developing the hepatocellular carcinoma. So this decomposited cirrhosis is treated with either oral nucleotides or the oral nucleosides inhibitors. And these are the entecavir, tenofovir alfenamide, and the tenofovir disoproxil fumarate. Lamivudine was given first, but because of its resistance, nowadays, in these days, the first line agents are the tenofovir and the entecavir. Entecavir, if there is the lamivudine resistance, it is given at the dose of 1 mg per day. But if there is no resistance, then it is given at the dose of 0.5 mg per day. While the tenofovir alfenamide, it is less toxic to that of tenofovir disoproxil fumarate. Tenofovir disoproxil fumarate is given at the dose of 300 mg per day, and it is more renal toxic and more bone toxic. But alfenamide, which is also the modified version of tenofovir disoproxil, it is less toxic. So these are continued in the decomposited cirrhosis for several years or for the indefinite period of time. Now, treating the composited cirrhosis, before treating the composited cirrhosis, you must go for the viral load. If it is greater than 2000 international unit per ml, one international unit is equal to 5 copies. If viral load is greater than 2000 international unit per ml, then treat the patient same as that of decomposited cirrhosis. Now, coming to the stage where the patient is not developed cirrhosis. So before treating the patient in which the patient is not developed cirrhosis, but he is in the chronic hepatitis B stage. So before treating such stage or such case, you must order the LFT. If alanine transaminase level, you have to see whether the alanine transaminase level is normal or the abnormal. If alanine transaminase level is less than or equal to 2 times upper level of normal, then again you have to see these phases, whether there is hepatitis B E antigen positive, and this hepatitis B E antigen is positive in the immune clearance phase, or whether hepatitis B E antigen is negative, and it is negative in the reactivation phase. So if it is positive, go for the viral load. If viral load is greater than 20,000 international unit per ml in the hepatitis B E antigen positive, and within the hepatitis B E antigen negative, if the viral load is greater than 2000 international unit per ml, that means if viral load is less than 20,000 international unit per ml in hepatitis B E antigen, there is no need of treating this patient. Okay. If within the hepatitis B E antigen negative, that is immune reactivated phase, it is less than 2000 international unit per ml, then there is also no need of treating this patient. But if it is greater than 20,000 international unit per ml or 2000 international unit per ml, then you have to see whether the age of patient is 35 to 40 years, whether there is a history of hepatocellular carcinoma in the family, or whether liver biopsy shows the fibrosis of grade 3 to 4, or beta-1 score shows the fibrosis of grade 3 to 4. At this stage, you have to again treat the patient regardless whether the ALT level, that is alanine transaminase level, is normal or not. But if the alanine transaminase level is abnormal, then definitely you have to treat the patient. So in same patient, you have to see whether the patient is in the immune clearance stage or in the reactivated stage. In the immune clearance stage, if the DNA or the viral load is greater than 20,000 international units per ml, then treat the patient. You have here you have got 2 options. Either treat the patient with the pegylated interferon or treat the patient with oral nucleotides or the oral nucleosides. Okay. Again, in same fashion, either treat the patient with the pegylated interferon or oral nucleosides or the oral nucleotides inhibitors. But if there is immune clearance phase, that is hepatitis B E antigen is positive, then the duration of pegylated interferon is 48 weeks, and it is usually given at the dose of 180 micro per week. It is given at the dose. It is given for 48 weeks, but in the reactivated phase, it is given for 1 year. So this is all about the treatment of the chronic hepatitis B, and the main side effects are the pegylated interferon or the thrombocytopenia, anemia, hypothyroidism. So when you start this treatment, after every 4 weeks, you must go for the LFT. You must go for the blood CBC, TSH. Now, whether the at here one clinical point I would like to give you, whether the antivirals are working or not, you have to see viral load if it is decreasing by 2 log after the start of treatment of antiviral agents, then we call that antivirals are working. But if they are increasing by 2 log, then we say that they are not working and the resistance is being developed against these agents. So this is all about the treatment of the chronic hepatitis B. Thank you.